Good morning and welcome to Ask Dr. Murphy, This Week in Public Health. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you this morning?
Doing quite well, thank you.
Dr. Robert Murphy is the Executive Director of the Havey Institute for Health, Global Health, and the John Philip Fair Professor of Infectious Disease here at Northwestern's Feinberg School of Medicine. Today, Dr. Murphy will be answering a viewer-submitted question and addressing the latest headlines through today, February 13th. Any questions or comments are welcome down below or in any of our social media linked in the description. Starting today with more influenza news. We got more reports this week of pediatric flu deaths, as well as some conflicting reports on how our government is handling the flu as a whole. Can you bring us all the news?
Yeah, so flu is still out there. We're in the middle of the height of the flu season, and flu can adversely affect many people, including children. The vaccine is recommended was recommended for 6 months and older in everybody. Children can die from the flu. There are 8 pediatric deaths recently reported. That's a total of 60. And if you look at the country as a whole, the estimates are that 22 million people have gotten sick with the flu. That has resulted in 280,000 hospitalizations and 12,000 flu-related deaths. This is actually kind of a typical flu season. But the U.S. is sending some conflicting messages about controlling the next flu epidemic next year, because that is selected based on what's going on in the Southern Hemisphere during their winter, which is coming up. As people may or may not remember, the United States has left the WHO as of the beginning of this year. It's a big mistake because we're all in this together, and especially with these respiratory conditions. However, they did say they would participate in an upcoming meeting in Turkey that's going to talk about the composition of the next flu vaccine. So you have to change the vaccine every year. And they're going to participate in that, even though they're not part of the WHO anymore and they stopped paying all their dues. Also, what happened was Moderna has an mRNA flu vaccine that has been studied in over 40,000 people, following the guidelines that the FDA had given them, and now the FDA refuses to look at the data that would result in its approval. So this is a different vaccine. It's made in the modern way, the mRNA approach. It's more effective. Remember, these flu vaccines are notoriously low in efficacy rate, but when you give it to a lot of people, there's a gigantic difference. Like with the COVID vaccine, even if you get the flu, if you had the vaccine, you have a milder case. End up less in the hospital. So why Moderna was stopped in its tracks is it's strictly just political and just this false belief that mRNA vaccines shouldn't work. mRNA vaccines are an improvement over the older versions of the vaccine. They've been given billions of times, and with COVID in particular. So this is just nonsense. And the approvals are going on around the world, Canada, Europe, Asia. They're all reviewing the same data that the FDA was supposed to approve, but now the FDA is not even going to look at it.
Yeah, and it's especially strange.
A US-based company, makes a better product, and they won't even review it. They won't even review it.
Yeah, especially strange because, as you noted, they also previously approved the phase studies and data for this specific vaccine. So just a strange reversal there. But We do have more flu news, and it's coming out of China, actually. This is about the avian flu, not the same exact strain we saw here in the US,
Right.
but there are more human
Not the regular
cases.
flu. This is the avian flu we talked about in the past, about you get it from birds. They had three more cases in China. None of them have died, and they've reported some, I think, 20 total cases over the past 6 months.
Hmm.
So that's
So
out
something
there
to keep an eye on. Yeah,
lurking
not exactly
around,
what
but
we saw here.
right.
And we do keep noting that. Luckily, those patients, as you said, did not die, but I understand that avian flu has traditionally had a much higher death rate.
Well, other Asian countries have reported death rates up to 50%. So that's the big problem here. Now, these three cases, I don't know of the whole 20. That was the first I heard about that, about China reporting. But those three cases are alive. They're so far.
Mhm. Now, coming back over here to the US on maybe our most popular topic we've had, as it's been a big, big outbreak, measles. More measles cases this week, and we had a specific question from a returning viewer, which was, what is the CDC doing to stop this massive outbreak in South Carolina? And is the federal administration doing anything to urge vaccination?
Well, the messages have been so conflicting that people have shied away from the vaccine or given the option not to take the vaccine. The measles used to be mandated pretty much everywhere. And remember, in the year 2000, we had zero cases, no measles. Um, Now, with the vaccine rates going down, wherever it gets into the population where there's not enough people vaccinated, and we're talking about you need 95% coverage to have really good, you know, population suppression. Like South Carolina has dropped way below that, and they've got all these cases. 910. This is bigger than the West Africa outbreak. 34 more from last week, mostly over 94% unvaccinated, and 30 of them have been hospitalized. It's just really incredible. Now, the Dr. Mehmet Oz, who is not with the CDC, but has been on television in the last week, uh, saying, recommending that people should be taking the vaccine. So this is, so we're getting messages from him to go ahead and take it. He is a medical doctor, unlike Secretary Kennedy, who's an environmental lawyer. And he's recommending it, but it's with this kind of conflicting stuff and without the mandates to take the vaccine, this is just going to go on basically forever.
Hmm. And there are tens to hundreds of people who remain in quarantine in South Carolina, but as it happens, there are still
Mhm.
cases popping up.
Mhm.
Now, one other thing that we've been talking about related to vaccines for a long time is aluminum. People are scared of these aluminum salts that are in the vaccines. Now we have even more data on that very subject. Can you break it down?
Yeah, so aluminum is the most common element in the Earth's crust. It actually makes up about 9% of everything in the Earth's crust. So it's everywhere. They use very small amounts um, to stabilize the vaccine and make it work better. This has been going on for decades, all right? So the lifetime exposure from every vaccine you take to the aluminum results in about 12 milligrams exposure to a person, all right? Dietary lifetime exposure, food, water, baby formula, you name it, anything in an aluminum can, is the amount is 468 to 2,785 milligrams. That's over 200 times more exposure than you get from the vaccine. So if you're worried about aluminum, you got to put it into perspective. And, it just has never been associated with any particular problem. It's just some theoretical, magical risk that nobody seems to be able to prove. And it's been around and it stabilizes all these vaccines and makes them work better. With the aluminum, the dose of the vaccine can be significantly reduced. So you actually, the person doesn't have to be exposed to as much of the antigen that stimulates the response to, then you develop the person makes the antibody against that disease, measles in this case. And I mean, that's how this has been working for a long time. And so to focus on aluminum is, I mean, basically nothing short of ridiculous.
That's really fascinating. I didn't know that that's why the aluminum salts were in those vaccines, but
Mhm.
makes a lot of sense. And our final story today
12
is,
milligrams in your life. It's nothing.
yeah, 200
Hmm.
times from food and environmental factors. That is a very significant difference statistically. Very significant. Now, our final story today is talking about HIV funding here in the US. And there are some proposed funding cuts that could affect 4 US states, including Illinois. Can you tell us about the other states and what this funding does?
Well, the sad thing is that there are still new HIV infections in the US and worldwide, more new infections than deaths. So that means that the HIV epidemic or pandemic is continuing to increase. Now, granted, it's at a very slow rate, and ultimately, we hope, to get it as soon as we have more deaths than new infections, the whole thing starts to go down. And we can do that in a number of ways. We can try all sorts of prevention measures and education, behavioral things. We can give drugs to prevent high-risk people from getting HIV. You know, many of those drugs have become generic, so the prices drop down. There's a lot of things you can do. So there's there had been um, a significant amount of money, many millions of dollars, uh, put into this prevention effort to get that curve to come down. So guess what? The federal government has cut prevention measures from programs in Illinois, California, Colorado, and Minnesota through the Centers for Disease Control. A lot of these have already been approved by Congress and earmarked for these specific programs for a variety of populations. And the funds are being blocked now. So in those 4 states, so why those 4 states? It makes no sense that it's being blocked in those 4 states, other than it's just political. So it's just a mean and cruel way to make this HIV epidemic continue on in a growing phase rather than starting to come down. Once it starts to come down, it could be extinguished. And that's what everybody hopes for, using all the tools that we can to decrease the number of new cases. So it's just incredibly short-sighted.
Mhm. And anecdotally, as someone in Generation Z, I did not see firsthand just how devastating the HIV and AIDS epidemic was here and globally. So it
Yeah.
is, hard for me to imagine just how terrible it was. And, we got to hope to keep that hard work that has been done going in that direction to keep the
Mhm.
cases going down.
Mhm.
On that note, a sad one this week, but I'd like to thank you, Dr. Murphy, for bringing us all the pertinent information, answering our viewer submitted question, and keeping us up to date on all that is in public health this week.
Well, thank you, Katie. Have a great weekend.
And Thank you. And thank you all for joining us this week for Ask Dr. Murphy This Week in Public Health. We'll see you next week. And if you have any of your questions or comments, please leave them down below or any of our social media linked in the description. Have an excellent weekend.